Today we'll talk about the most scary question which comes to every postmenopausal female's mind. Is postmenopausal bleeding cancerous? No, this is a very common question which bothers almost everyone who gets vaginal bleeding after menopause. It looks scary, but believe me, after watching this video, you will get all your answers. So hi there, I'm Dr. Deepti Asthana, Senior Gynecologist in Fortis Hospital in Gurugram and Director of Kalosa Clinic. Stay connected till the end to gain all the knowledge revolving around this topic. Also subscribe my channel Kalosa Gynae to have regular updates about female reproductive health. You can visit my websites drdeeptiasthana.com and kalosaaesthetics.com for the same. Menopause is officially confirmed if it has been 1 year since your last menstrual period. Now, menopause occurs when ovaries they cease making estrogen and the patient is no longer ovulatory. Now, postmenopausal bleeding can range from light spotting, that is pinkish gray or brown, and all the way to a heavy flow like a regular period. Now, most of the time, there's no pain with the bleeding. Whatever amount it is, it surely makes you very much concerned, and of course, you should never ignore all this. You should immediately reach out to your doctor. Now, what happens when you reach your doctor? Your gynecologist would ask 3 important questions. Number 1, when did you go through menopause? The longer it's been, the greater cause for concern and more testing we might need to do. Number 2, are you taking any new medications? Now, some drugs such as blood thinners and some mental health medications can have vaginal bleeding as a side effect. Now, number 3, what else is going on with your health? Other medical conditions could be relevant. Example, a history of obesity, polycystic ovarian syndrome, diabetes mellitus, or tamoxifen use may all increase your suspicion for hyperplasia or malignancy. Now, a pelvic examination usually is needed when we are talking about unexplained vaginal bleeding. Now, during the examination, your gynecologist may look at your vagina, your cervix, and rule out any cervical polyps. And he or she will feel the size of your uterus too. A pap smear would be taken for cervical cancer screening. Now, the next steps would be a pelvic ultrasound to look at your uterus more closely. Note down thickness of the endometrial lining. Any lining more than 4 or 5 mm with increased echogenicity demands further evaluation. A biopsy would be planned for such cases to take a tissue sample from the lining of a uterus, usually under hysteroscopic guidance, where you go inside your uterus through a camera, examine it, and biopsy the suspicious areas. This tissue is then sent to a lab for further testing. Now, let us look at the causes of postmenopausal bleeding and their treatment. Now, there can be several causes for postmenopausal bleeding. One most important reason for postmenopausal bleeding could be that the tissue of your vagina and the vulva has gotten thin. This can happen during menopause due to hormonal changes. If you experience the bleeding after intercourse, it may be from the friction against this thinner, more sensitive skin, and your gynecologist still would look for further evaluation to be completely sure. Now, bleeding is usually self-limited and requires no treatment. Vulvar and vaginal atrophy may be treated with lubricants during intercourse, topical hormones such as estrogen, DHEA, etc. Endometrial and cervical polyps also can cause vaginal bleeding. If your gynecologist discovers these benign, non-cancerous growths in your uterus or on your cervix, you might need minor surgery to remove them. Removal of the polyp may resolve the bleeding. Now, endometrial polyps are often benign, but they can contain hyperplasia or malignancy approximately 5% of the times. Because of this, complete hysteroscopic removal should always be done. Removal is recommended, especially in patients with symptoms or at risk of malignancy, such as which have larger polyps, have had tamoxifen use, obese, and diabetics. Some mucous fibroids may be removed using a hysteroscope, or they may be ablated with various devices. Now, some lesions are amenable to uterine artery embolization. Ultimately, if minimally invasive approaches are unsuccessful and the patient is significantly bothered, definitive management with hysterectomy can be considered. Now coming to other causes, cervicitis. Now treatment of cervical infection is recommended as indicated by the organisms. Other possibilities, you could be bleeding because the lining of the uterus is too thick. Now, in some cases, the cells of the lining can become abnormal, leading to cancer. Now, though cancer is the most serious but also least likely cause of bleeding after menopause, all the testing should always be done so that we do not miss out this important cause. If testing finds cancerous cells or cell changes that could lead to cancer, you would be advised for uterus removal surgery. Now, even if it isn't cancer, you may need future ultrasounds to keep an eye on things. Do not skip follow-ups as these are very important, and if you think you cannot go for follow-ups, please notify your doctor prior so that she can tailor-make best plan for you. Now, there are some medications which can also cause bleeding. Now, if phytoestrogens are suspected of causing stimulation of the endometrial lining, they can be stopped and further endometrial evaluation may be performed as above. In patients taking postmenopausal hormone replacement, the regime should be stopped or adjusted. The postmenopausal hormone therapy may also lead to uterine abnormalities as above, and if so, they should be treated as indicated. If you're on anticoagulants, medical management with progestin may control bleeding until the anticoagulant course is complete. Longer-term solutions may need to be discussed in patients on lifelong anticoagulation. Now, other causes such as hemorrhoids or UTI should also be ruled out if the patient is not sure about the source of bleeding. Now, coming to the prognosis. Overall, the prognosis of postmenopausal bleeding is favorable because the most common etiologies are benign. Once the etiology of the bleeding is identified, treatment can be instituted. Even in cases where endometrial cancer is diagnosed, the prognosis is better compared to many other malignancies. Over 70% of endometrial cancer cases are diagnosed at stage 1 with an associated survival rate at 5 years of 90%. Now, to conclude, if you see even a spotting post-menopause, act now, not later. Bleeding after menopause is not normal, so please take it seriously. Go directly to your gynecologist. Chances are there's no reason for panic, but only thorough evaluation can make sure what we are dealing with. If you like this video, do press like button and subscribe my channel Closer Gynae. You can also follow me on other medias like Instagram. Log on to my websites drdeeptiasthana.com and calosaesthetics.com for more information about female reproductive health. Stay healthy, stay happy, and take care. Bye.